It is not the plantain you ate in pregnancy or the banana you ate in pregnancy that's causing your baby to have oka, split fontanelle. It is basically a sign of malnutrition or dehydration. If you are just joining me today, you are very welcome to my space. My name is Oluwa, your real Sabi midwife. So if you are just joining me today, you are very welcome to my channel. You're very welcome to my space, and please do subscribe to my channel. Subscribe to my YouTube channel at Sabi Midwife. Follow me on Instagram at Real Sabi Midwife and on TikTok Sabi Midwife. Thank you very much. Yes, what am I talking about today? It is oka, split fontanelle. I know this topic is a very controversial topic, especially among Nigerians, because there's a lot of misconceptions, superstitions, and myths surrounding it. Oh, some people say, oh, because you add too much plantain. Oh, because you add too much banana in pregnancy. Oh, because you add this in pregnancy, and that is why your baby is having oka. I'm sorry to bring you the news that it is a lie. It doesn't happen that way. Oka is a sign, is majorly a sign of dehydration or malnutrition. And when I mean oka, I mean split fontanelle. Oka is the name that is being called in Yoruba language. Now, what happens when a baby is born? A baby is born with 5 bones in the head that are not completely fused. We have the 2 bones at the forehead, 2 bones at this part of the and 1 at the back. The one at the forehead and this place join together to form the anterior fontanelle, and the one at the middle and at the back meet at the back to form the posterior fontanelle. And that is why you can see 2 soft spots on the baby's head. Now, what happens when babies are born? Before in pregnancy, the whole bones of the head, they are laid down in cartilage, like ikeron kere. So they are laid down in cartilage. Now, God has so made it such that they are not made down in they are not laid down in bones completely, so that they are able to pass through the birth canal. Now, what happens during birth is that the 2 bones of the 2 frontal bones ride over each other. The 2 parental bone ride over each other. The frontal bone override them. All the bones override each other just to make it as compact as possible to pass through the birth canal. Women are trying. Women are trying. Now, so after 2 to 3 days, the fontanelles, the head, the cartilages, they start to go back to their place. And now, after like 5 days, those mommies that came to help you to take care of your baby, do not start looking at it. It's like this head is giving way. This baby is starting to have oka. You had too much plantain in pregnancy. You had too much banana in pregnancy. Oh, you want more? Why did you do all of this? Now, it is just a normal physiology. And now when you now see that, oh, it is becoming really obvious, the bones of the head are becoming really obvious. Before we say that, oh, it is actually split fontanelle, is the baby slim? Because in most slim babies, that's when we see this very obvious bones of the head among slim babies. You can imagine a slim adult. You can see the bones of the neck. You can see the bone of the cheek. You can see the bones of the hand, very obvious, very conspicuous. And that's what happens to these poor babies. Now, if your baby has split fontanelle, it is not because you add plantain in pregnancy or banana in pregnancy. It is simply a sign of dehydration. Now, what you should check, is this baby having enough milk? Is this baby taking enough food? Now, I recommend breastfeeding 100%. If you have just had your baby, the WHO recommendation is to breastfeed your baby. Now, for people that can't breastfeed for one reason or the other, now you are supposed to give formula feeding. Now, these people, how many times are you breastfeeding this baby? No, you're breastfeeding once or twice. Oh, he's not even sucking. I'm tired. How many times are you giving baby formula? You put 1 scoop of formula into 60 ml of water, and then you shake and you give this baby. 1, the baby is not getting enough nutrients that is needed for the growth and development of the baby. Now, you are even giving correct milk formulation, or you are giving breastfeeding, but it's saying you that will give concoction 5 a.m. in the morning, concoction 2 p.m. in the afternoon, concoction the last thing at night. Now, I am not saying that you should not use concoctions for your baby, but I don't use concoction for my baby. But if you have to use concoction for your baby, what you should know that when you are using concoctions for your baby, most of the concoction actually uses the glucose, the body glucose, to actually work. Now, this same baby that you are not breastfeeding very well, that you are not feeding very well formula, is the same baby that you will give concoction to in the morning, in the afternoon, and at night. Now the baby start becoming dehydrated because the baby is not getting enough water, the baby is not getting enough nutrients necessary for the growth and development of the baby. And then you now start saying, this baby is having oka or split fontanelle. You now give baby another concussion. Agboka. You start series of different concoctions. I know it's not your fault. It is people that have come to see you and they are very concerned about the baby. But let me tell you something. If your baby has oka, split fontanelle, what you need to do is drop everything you are doing and breastfeed this baby. That is all you need to do. Breastfeed this baby on demand as much as you can. Averagely, a baby is supposed to feed between every 2 to 3 hours. That's between 6 and 8 times in a 24 hours period. Now check yourself. How many times are you feeding your baby? How many times are you breastfeeding your baby? And if you are formula feeding your baby, it is written on the formula can. But I know that we don't read a lot. If you buy a formula for your baby, read what is on the body, on the tin. There's a recommendation for it. If you're supposed to feed your baby 6 to 8 times in a day. And for formula fed children, please always give water. If you're formula feeding your baby, please give water. Water is very, very essential for them. Now, if your baby is having oka, seek medical advice. Take your baby to the hospital. If your baby needs nutrients, it can be as a result of some vitamin deficiency. If your baby needs nutrients, medications, yes, let the baby get medication. But what you need to do is feed your baby 100%. I've had people that has oka, and I stepped in to breastfeed this baby. Like, I don't breastfeed the baby anyways. I told them to breastfeed their babies. But they did breastfeed their babies, and then these babies started gaining weight. So if you find this useful, if you have any comments, any questions about it, do like it, drop the question, and I'll be there to answer your questions. If you have any preference for the topic you want me to treat in my next episode, feel free to drop it in my comment section. Thank you very much. Please don't forget to subscribe to my channel at Sabi Midwife and follow me on Instagram at Real Sabi Midwife. Follow me on TikTok at Sabi Midwife. Thank you very much. Bye.